Welcome to this edition of the Designs for Health audio science article.
In part 1 of this blog series, we explored foundational dietary guidelines that support the management of high blood pressure. In this next part, we will look at the most common nutraceuticals whose ability to modify blood pressure has been scientifically established and which may be vital for managing the tough cases of hypertension. Hypertension that does not respond to basic lifestyle modifications, including dietary improvements, weight loss, exercise, and stress management, can be rooted in various etiological dysfunctions. Genetics can certainly exert a strong influence on blood pressure, but so can disruptions in vascular, hormonal, renal, and neurological regulatory functions. Heavy metal toxicities are another potential trigger. Oxidative stress is nearly always both a cause and effect of hypertension, making antioxidant support a necessary addition to any plan. Identifying the cause of hypertension can be difficult. The variability in causes can also make specific nutraceutical recommendations difficult because a very individualistic approach is required. What may be effective for one patient may not work for another. Understanding the mechanisms of action behind some of the most well-studied nutraceuticals for hypertension can help determine where to start and what to suggest for patients. Aged garlic extract ranks high on the list for hypertension due to its high efficacy and tolerability. A meta-analysis of 9 randomized controlled trials, including 482 individuals treated with aged garlic extract for 8 to 26 weeks, showed a weighted mean difference for a systolic blood pressure of negative 9.1 millimeters per mercury and diastolic blood pressure of negative 3.8 millimeters per mercury. Hypertension can indicate problems with the hydrogen sulfide and nitric oxide signaling pathways, which are important for inducing smooth muscle relaxation, vasodilation, and blood pressure reduction. Garlic-derived polysulfides stimulate the production of vascular hydrogen sulfide, enhancing the regulation of endothelial nitric oxide. Further, aged garlic extract has ACE inhibitory and calcium channel blocking activity, both of which reduce catecholamine sensitivity, increase bradykinin and nitric oxide, and improve arterial compliance. It is important to note that the hydrogen sulfide and nitric oxide pathways are influenced by vitamins B6, B12, and folate levels, so individuals with the MTHFR polymorphisms may not respond as favorably to aged garlic extract until these nutrient levels are supported. Molybdenum levels should also be assessed because of their role in sulfur detoxification. L-Arginine is a semi-essential amino acid or conditionally essential amino acid that functions as a substrate of nitric oxide synthase and has been shown to significantly reduce blood pressure. A meta-analysis of 11 randomized controlled trials, including 387 subjects, showed a weighted mean difference for a systolic blood pressure of negative 5.39 millimeters per mercury and a diastolic blood pressure of negative 2.66 millimeters per mercury. Another meta-analysis of placebo-controlled trials performed to determine the effects of arginine on blood pressure in pregnant women showed similar results and prolonged gestational age, giving an option for women at risk for preeclampsia. L-Arginine not only supports nitric oxide production, but improves glucose metabolism and lowers blood sugar, and positively affects renal function, which may make it a good option for salt-sensitive individuals. Increasing dietary sources of potassium are important, but attaining levels high enough to address some forms of hypertension can be difficult. Potassium is routinely deficient in most diets, and yet it is extremely important in maintaining the correct sodium-potassium balance required to manage blood pressure. A meta-analysis of 23 randomized controlled trials involving 1,200 subjects concluded that potassium supplementation significantly improved both systolic and diastolic blood pressure in a dose-dependent relationship. Not only is potassium supplementation important to balance dietary sodium, but it also improves blood pressure by reducing vascular resistance. Like potassium, magnesium is an important nutrient for inducing vascular resistance, and low serum concentrations are an independent risk factor for high blood pressure. Unfortunately, magnesium intake has been steadily declining among Western countries, and even the most health-conscious individuals are lacking. According to a meta-analysis of 10 cohort studies, including 20,119 cases of hypertension and 180,500 participants, a 100 mg per day increase of magnesium intake was associated with a 5% reduction in the risk of hypertension. Magnesium is the 4th most abundant mineral in the body, and its effects on blood pressure have been noted for the past 4 decades. This mineral regulates cell membrane permeability for sodium and acts as a calcium antagonist to modulate vascular smooth muscle tone and contractibility. More recent research is focusing on the role of oxidative stress and impaired antioxidant systems as one of the key etiologies of hypertension. Vascular damage from reactive oxygen species and reactive nitrogen species not only triggers hypertension, but is also exacerbated by high blood pressure, creating a vicious cycle of chronic inflammation which leads to hypertension-associated cardiac risk factors. In a previous blog, we discussed coenzyme Q10 and homocysteine as good markers of oxidative stress related to hypertension. More recently, vitamin D has been identified as a promising antihypertensive through the activation of antioxidant mechanisms. Low serum vitamin D, a well-established global problem, has been associated with hypertension. Vitamin D decreases renin-angiotensin-aldosterone system, or RAS, activity, modulates endothelial function, and regulates vascular oxidative stress. Several clinical studies have shown vitamin D to improve blood pressure in a dose-dependent manner. Hawthorn has a long history of use for cardiovascular health. Its high bioflavonoid content renders it a highly effective antioxidant that has been shown to reduce oxidative and inflammatory stress in models of deoxycorticosterone acetate, salt-induced hypertension. Studies also show it can activate endothelial nitric oxide synthase, causing vasodilation and reducing blood pressure. Pomegranate is another antioxidant-rich botanical to consider, due to its high content of polyphenols. In a double-blind, placebo-controlled, randomized controlled trial of 55 subjects taking pomegranate extract or placebo for 8 weeks, a significant decrease in diastolic blood pressure was noted among the test group. Hypertension doesn't seem to be taking a vacation from our list of prominent and growing health problems anytime soon. Correspondingly, more individuals are concerned about the lack of non-pharmaceutical options for managing this condition. And yet, numerous nutraceuticals have shown a significant impact on blood pressure when used in combination with positive lifestyle changes. It may take a little effort to determine which nutraceutical will best address each case, but with effort, one or two is almost certain to bring optimistic results.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.